Well, good morning, everyone, on this fine Wednesday. Um, Hope everyone's been having a good week, managing to survive this with as much happiness and vitality as we can. Um, so, um, yeah, let's give the coronavirus update, and then talk about how containment measures are working. So, you know, the U.S. has now surpassed 50,000. There's 54,968, almost 55,000 cases of coronavirus now, confirmed cases in the U.S. 53 of those, almost 54,000 of those cases are active cases. There have been 784 deaths. So we've gone from, let's see, on March 21st, we had just shy of 20,000 cases, 19,755. Now we're up to 54,000. So that shows you what kind of progression we're having. In New Jersey, the cases are up to 3,675. They were 1,300 on March 22nd, so a few days ago. 44 deaths now in New Jersey. So, good morning, Nancy. Good morning, Mitch. Nice to see you. Um, I want to talk about New Rochelle, New York, because New Rochelle on March 1st had their first case of coronavirus. So that was March 1st. By March 8th, they had shot up to 108 cases. So that was exponential growth. That was doubling just about every day. Then within a couple of days, strict containment was put in. National Guard was called in to deliver food to people who were quarantined. Strict isolation measures, and if that had not happened, if that exponential growth had continued, they would be well up into the thousands by now. Um, so, but new cases are 225 there now. So that tells us that the isolation, the social distancing is working when it's applied strictly. What I worry about is places like New Orleans, where Mardi Gras happened right as this was all getting going. And now that is a major hotbed of infection. They have 1,388 cases confirmed right now, 46 deaths, and they are just now, getting to the strict isolation. So those cases will continue to grow, I believe. I think this shows the danger of not putting the strict isolation in before you get to a problem. Once you wait until your state has a problem, then the cases are going to get ahead of you. So I think the states that have put the strict measures in now, there'll be fewer cases in this go around that we're having. But the states that are waiting, if they wait till they have a major hotbed of infection, that usually for at least a few weeks will cause that to get worse. So President was on last night and hoped the country would be reopened by Easter, though he says he has some flexibility on that. Um, I think that will be nothing short of miraculous for that to actually happen. I think that there will be cases will continue because of the lack of the social distancing and isolation that we've seen. Um, New Jersey is certainly taking it very seriously. There was the case, where somebody coughed on a Wegmans worker and said he had a coronavirus after she asked him to step back out of her space, and he's actually been charged with a terroristic threat. So certainly the government is taking this seriously. Um, and we hope people will remain civil and will, respect people's boundaries. So, does anybody have any questions? You know, anything we want to talk about? Um, you know, certainly haven't seen any cases in any of our current patients um, in our practice, which I am happy about. But we we're trying to keep our everyone in our practice. We're trying to have them be as healthy as possible, taking care of their gut, taking care of their microbiome, uh, helping to take supplements to support their immune system. Jenna's immune support group is providing guidance on that, and I recommend that people check that out. Um, you know, I think we, have to just keep riding this storm, see where it takes us. Um, but I'm hopeful that with the strict isolation that's been in place in New Jersey, that we will flatten that curve in the next week to 10 days, um, and hopefully see a much slower rise than would otherwise be anticipated. So, um, well, if nobody has any questions for me this morning, I guess I will sign out and I'll be back on tomorrow morning um, and giving you the live update and seeing what's in the news for the next 24 hours that's worthy about talking about. Anybody has any questions about that or has any, again, suggested topics, anything they'd like to hear about, whether it's about coronavirus or we can certainly talk about other things here also. Um, though I think it's going to be hard to grab people's attention. Um, Certainly willing to get advice from the audience about what what's worrying them, what's concerning them, and so Nancy has a question, advice regarding disinfecting packages that come by delivery. Is it necessary? I don't know if it's necessary, Nancy, but certainly out of an abundance of caution, I think it's not a bad idea. You could spray them with one of the disinfecting sprays like Lysol. Um, you know, we don't know. I guess there could be a scenario where the worker coughed on his hand or his glove beforehand and then picked up your package. So I guess I would say that not a bad idea to disinfect that. It's probably being extra cautious. So um, I don't know how many cases have been passed that way, but if there's any concern, I would certainly recommend that do that. They're finding it does live on surfaces, so I guess it's theoretically possible that it could be passed that way. Thank you for that question, Nancy. All right, anybody else have any other questions? All right, I will talk to you soon. And thanks again for joining, everyone. Thanks. Nice to see you, Betsy and Michelle and Jenna. Um, and I'll be back on at 8 o'clock tomorrow morning. Okay, everybody have a great day. And if you have any questions, either put them here or shoot me a private message, whatever you feel most comfortable with. Okay, everybody have a great day. Thanks. Bye bye.